Hi, I'm Dr. Dave Janda. Welcome back to the Operation Freedom platform and our ongoing health and nutrition series with our expert, Dr. Peter Glidden, who is one of the top naturopathic physicians, not just in our country, but the world. In addition to being a fantastic clinician, he is also a researcher and author. I encourage you to get his books. They are the foundation of our medical library. They should be of yours. They are available on Amazon.com. Also, you can go through his website, Dr. Glidden, Glidden, drglidden.com. Everybody is sick, and I know why. An attempt to cure with holistic medicine. What we're going to do today, as you know, we have our website, OperationFreedomHealth.com. And on that site, we have Peter's video of the 12 bad foods. We have the dozens of videos that Peter and I have done over the years on issues and medical issues, as well as health and wellness. But we also have the products that we speak about. And full disclosure, purchase of the products does support this platform. Now, when folks go to our website and they get their tremendous amount of free information, OperationFreedomHealth.com, and if they purchase our products, one of the things we do is we provide an educational series for the folks that purchase through us as a benefit. And through our website, we provide extra information other than what's provided on the website, and kind of at least one, sometimes two, sometimes three newsletters that come out a week, run by our boss Brett, who runs the show. Really, he's really quite adept at it and very good and very thorough. One of the top intellects in the world when it comes to health and nutrition as well. But one of the things we also do is through Brett, and we provide a feedback loop for our members that support our Operation Freedom Health site, an opportunity to ask questions. And what I thought we would do, and Peter does not know these questions, this is why we do it in an extemporaneous live fashion. We're going to do an Ask the Expert session with Peter. And these are questions that were put forward by Operation Freedom Health members. Pete, you ready to go?
I've got my coffee, Dave. I'm ready.
Doc. All right, here we.
I haven't heard any of these questions before,
No.
And this is good, I think, because it will give people in the listening audience insight, perhaps, hopefully, into how holistic doctors think about illness.
Mm-hmm.
That's important
Mm-hmm.
because it's not. This is the thing that separates different medical practitioners, right? Is the philosophy inside of which they're trained. You know, you were trained in a different philosophy than I was.
That's
Chiropractors
right.
have a different take. Acupuncturists, traditional Chinese medical practitioners, Ayurvedic practitioners, homeopaths. Everybody has a different lens that they view these things from. And so this will be fun. I'm ready to go. Let's go.
Here we go. First question. My question is about blood pressure. I am a 59-year-old woman. My blood pressure consistently runs in the borderline hypertensive range, even with medication. I am a healthy weight, about 135 pounds, 5 foot 6 inches tall, exercise regularly, eat fairly healthfully, and which includes Longevity's Healthy Body Regime, or Healthy Body Foundation Pack. I am working to remove toxins from my food and water, although who can do that completely living in a suburb of a major metropolitan area, in her case, Dallas. I am taking zeolite daily, drinking filtered fluoride-free water, eating organic, GMO-free foods. I have been taking prescription medication Diavan hydrochlorothiazide for her blood pressure for years, but want to get off all pharmaceuticals. Currently, this is my only prescription. I've heard you, Dr. Glidden, discuss that if making nutritional changes do not fix blood pressure, then there is a possible blockage in the kidneys. I do retain water easily, so I suspect this could be an underlying issue. So what are the next steps to correcting blood pressure?
Okay, so the first thing to consider is whether or not there really is a blood pressure issue, because the pharmaceutical industry has cooked those books and they have moved the goalposts over the last 30 years in order to sell more drugs. Not really because, you know, it's backed by the science. So here's what I know concerning blood pressure and the values thereof. Okay, so first of all, in order for anybody to be clinically diagnosed as hypertensive in need of immediate treatment, they have to have 3 consecutive blood pressure readings where each number is elevated above 140/90 3 times in a row.
Mm-hmm.
That's 8 o'clock, 8:15, 8:30, or Monday, Tuesday, Wednesday, 3 times in a row. Each number has to be above 140/90. So it's got to be 143/95, 145/100, whatever. Both numbers have to be elevated 3 times in a row. What happens most of the time, especially in the last 20 years, is when one of those numbers is elevated one time in the doctor's office, because the patient's nervous and anxious because they're in the doctor's office.
Right.
They're diagnosed as hypertensive and put on a blood pressure medication, because the way that conventional medical doctors are trained to think is it's only a matter of time until this person has high blood pressure, because high blood pressure is just a part of the aging process. So I'm going to put my finger in the dike here and stop a big problem down the road from happening. I know that this isn't technically hypertension, but it's only a matter of time. So I'm going to help the patient now. And that's a problem for a lot of reasons, because number one, in this case, hydrochlorothiazide, after 5 years of hydrochlorothiazide, a side effect, a direct side effect of hydrochlorothiazide is type 2 diabetes. The medicine causes type 2 diabetes. It's a known side effect, and it's not a small side effect. It's a high percentage of the time. It takes 4 to 5 years to develop, depending on your height and your weight and your body mass. So, right, so is that a good idea to take a medicine for one thing that maybe isn't really a thing and then have that create another condition 5 years down the road? From our point of view, that's insane. You wouldn't want to do that. Mm-hmm. It's nuts to do that, quite frankly. So, first of all, you have to figure out whether or not you are, in fact, hypertensive. So here's the best way to do that. You go to CVS, you go to Walgreens, you go to Amazon. Don't go to Amazon. You go someplace. You get a blood pressure cuff. You can measure your blood pressure at home. Mm-hmm. As you're driving home, you stop at the local firehouse. And you politely go in, and when the people in the firehouse are not out on a call, they're just hanging around doing nothing, you ask them to take your blood pressure with their equipment and with your equipment to see if your equipment is accurate. Because you got to know if your equipment's accurate, because it might not be. And, 5 millimeters of mercury makes all of the difference in the world. So it's got to be accurate. So you have them test it, and if it's accurate, you're good to go. If it's not, you take it back, get another machine, and figure it out. So now you've got an accurate machine. Every day, if you can handle it, between 11 a.m. and 2 p.m., this is based on your circadian rhythms, by the way, you take your blood pressure. But you don't just take it once, you take it 3 times in a row. And you only record the third reading. So you take your blood pressure once, you count to 10, you take your blood pressure again, count to 10, take your blood pressure a third time, and you record the third reading. And you mark my words, if you do it that way, each time the blood pressure is taken, the numbers will be a little bit lower. Because even if you're taking your blood pressure at home on your own, in the comfort of your own house, you're a little nervous.
Right.
You're a little amped up just because you are. So third time's the charm. And then you write the numbers down, and the next day you do the same thing. And the next day you do the same thing. The next day you do the same thing. It's 3 times in a row. And if on those 3 separate times, each number is elevated above 140/90, you're hypertensive and you need help immediately. If one of the numbers is elevated 3 times in a row, or just once, you're borderline hypertensive. You don't need medication, and you can intervene aggressively at this point with medical nutrition, which is a smart thing to do. So let's say you've done that. Oh my goodness, I am in fact hypertensive. What am I going to do? Well, first thing to consider is it's a calcium and a magnesium deficiency syndrome. Because there's little muscles in your blood vessels that constrict and relax in order to help the heart pump the blood. The muscle in your blood vessel isn't any different from a muscle in your arm. Well, it is a little bit, but the mechanism is the same. It needs calcium and magnesium to constrict and relax. Doesn't have enough of those, it will constrict, but it can't relax. So when it constricts, the blood pressure goes up. The same way that happens if you squeeze a garden hose a little bit, the water comes out faster, right?
Mm-hmm.
So, first thing to do is intervene with calcium and magnesium. So, the recommendation here is 1 bottle of Beyond Osteo FX liquid. I would do the liquid for this. Per 100 pounds of body weight per month, plus 1 extra bottle. So if you're 200 pounds, you do 3 bottles of Beyond Osteo FX a month. And the dose per bottle is 1 ounce per bottle per day. So if you have 3 bottles, you do 1 ounce of the Beyond Osteo FX 3 times a day. And so forth and so on. Now this, of course, is in addition to the other 90 essential nutrients. But concerning blood pressure, the first thing to consider is calcium and magnesium. So that's how you do it, and you follow that protocol for 4 weeks religiously, like your life depended on it, because, well, maybe kind of, sort of, it does. And every day you measure your blood pressure.
Mm-hmm.
And if the program is effective, you will see your blood pressure numbers start to come down.
Mm-hmm.
It's like watching ice melt in the springtime.
Mm-hmm.
Now, if you do that for 4 weeks in a row, and there's been 0 change,
right,
or your numbers are getting higher,
yes.
well, then it's not a calcium and magnesium problem. So the second consideration is it's a problem with your kidneys.
Mm-hmm.
That's really interesting. And Dr. Wallach taught me about this. It's fascinating, really. They gave Wallach, when he was doing his $25 million research program, a box full of kidneys of people that had died from kidney disease. And they said, Wallach, we need to figure out why they died. And so he did a visual exam. He was a master at autopsy. I don't know how many tens of thousands of autopsies the guy did. But in any event, couldn't see anything wrong with them visually. Looked with a microscope. Couldn't see anything wrong. Used an electron microscope. Holy smokes. All of the teeny blood vessels inside the kidneys,
mm-hmm.
which the kidneys use to filter your blood,
mm-hmm.
to create urine,
mm-hmm.
were clogged. Same way that blood vessels in the heart can get clogged. Mm-hmm. Well, the teeny blood vessels in the kidneys were all clogged. So what happens when that happens? Well, the kidney knows that the blood vessels are clogged, so the kidney secretes a chemical called renin.
Mm-hmm.
Renin goes into the bloodstream, travels into the liver, is transformed by the liver into angiotensin,
mm-hmm.
which increases your blood pressure.
Right.
Because the body's trying to blow through the clog that's in the kidney.
Mm-hmm.
Same way that you use a plunger in a jammed up toilet,
mm-hmm.
right?
Right.
So one cause that most medical doctors don't know anything about, and I didn't know anything about, I wasn't taught this in medical school, Dr. Wallach taught me this, was peripheral arterial disease in the kidney. Clogged, it's just fancy schmancy doctor talk for clogged blood vessels in the kidney. So what do you do if that's the case? Well, you do your best to stop eating food that's causing inflammation that clogs the kidneys.
Mm-hmm.
And the major culprit there, hands down, way out in front of all others, fried food. This is why African Americans have such a high incidence
of heart disease.
It's not because they have a bad gene. There's no gene that codes for high blood pressure. It's because they eat a boatload of fried food compared to everybody else. That's just their culture. So you stop eating the 12 bad foods, fried food being one of them. And then you give your body antioxidants, mm-hmm. because the body needs antioxidants to fight the inflammation that those foods are causing.
Mm-hmm.
And you take the good herbs heart support and the good herbs kidney support. Aggressive. Now what I would do is if you have hypertension and you're on meds, I would do 4 bottles of the heart support and 4 bottles of the kidney support every month for 3 months. And that's 4 milliliters 4 times a day. You can mix them together. So 8 milliliters 4 times a day of those 2 herbs, like your life depended on it, and then measure your blood pressure and see what's happening. And 9 times out of 10, with that strategy, the blood pressure comes down. Now, if you're on meds, I'm okay with meds, but the goal here is you got to make yourself so healthy that you don't need the med.
Yep.
Your medical doctor doesn't think that's possible, but we see it all the time.
Mm-hmm.
So if you are engaging this process, it's important that you take your blood pressure regularly, because if I give a person with normal blood pressure a blood pressure med, the blood pressure is going to crash.
Right.
And low blood pressure is a problem.
Mm-hmm.
Low blood pressure, you're sitting down, you feel good, and you stand up and you pass out.
Oh, right.
It's not good.
No.
So you just keep taking your blood pressure. As the blood pressure levels normalize, you go to your medical doctor, you go to a pharmacist, say, look, my blood pressure is getting pretty low. I need to come off of the meds, and they'll tell you how to do it. And bada bing, bada boom, Bob's your uncle. I mean, that's a really long answer to that question, Dave.
But it's an important issue, because hypertension is it's a big issue for folks. And
it's huge, and it's not helped by the fact that big pharma has messed with the numbers.
That's right, because they make you think there's nothing you can do by yourself, with your diet, with your nutrition, with supplements to address the issue.
That's right, and it might not even technically be an issue.
That's right. That's right.
You might not, in fact, be clinically hypertensive.
That's right.
So,
and the other thing, Pete, the other thing I found is that, you know, like you said, now a couple things. I want to unpack a couple things. You said take it between 11 and 2. Well, it's interesting, because what you find out when you get a blood and you start doing it at home, your blood pressure, you'll say, hey, how come my blood pressure is higher at 9 a.m. than it is around noon? And wait a minute, why is it higher around 7 p.m. when I'm sitting in the same chair? I'm doing the same thing. But this is this part of this circadian situation, and that's why taking it between 11 and 2 is important, because that's when you tend to cycle down a bit.
That's correct. So if you take it at the wrong time of the day, it's going to be high anyway, and that's not a bad thing. It's a normal thing, and if you didn't know that, you're going to be confused.
That's right.
Right? So all these little things.
Right.
Which you would think that your healthcare practitioner, who you're paying, by the way, hundreds of dollars a month, if not thousands of dollars a month in medical insurance premiums, you know, to have access to, you would think these people would line this up for you.
Mm.
But they haven't. I doubt very much that any medical professional has talked to you like I just did. I doubt it. And this is the problem. This isn't rocket science, for goodness sakes.
No.
This is simple stuff that nobody's told you, and more's the pity. So that's why, again, the work that we do is so important.
Now we're going to turn to ringing in the ears. Recently developed noises and ringing in my ears. There is so much misinformation out there. Do you know of any options that could help with someone like me, a male, age 62?
Certainly. So again, there's something called a diagnostic cascade, which is the things that you think about first when somebody has something, right? There's things that you think about first. So in ringing of the ears, which just develops spontaneously, right? Not because you were an artillery captain in the war, not because you were a roadie for a rock and roll band, right?
Mm-hmm.
And had loud noise all the time. That's different.
Mm-hmm.
If you just all of a sudden develop ringing in the ears, the first thing to consider, and this is interesting, is that it's osteoporosis of the skull.
Interesting.
It's really interesting, right?
Mm-hmm.
Most people don't know it.
So osteoporosis is thinning of the bone.
Right.
Okay, go ahead.
Thinning of the skull bone in this case.
Right.
Most people don't know it, but we've all got holes in our heads, right? Democrats have a lot more.
Yeah, right.
But everybody has holes in their head.
Right.
Because there are 12 nerves
Mm-hmm.
which come directly off of the brain and go to the eyes, ears, nose, mouth, and face.
Mm-hmm.
All the other nerves in the body come off of the spinal cord, go to different parts of the body as the spinal cord goes down your back. There's 12 nerves that come directly off of the brain, and in this case, they go to the ears, among other things.
Mm-hmm.
But to get to the ear, or the eye, or the nose, or the whatever, the nerve has to go through a hole in the skull. So you got 12 holes in your skull, right? Well, actually 24, 12 on each side. So I think if that's correct. Maybe not. I don't know. Don't quote me on that. But anyway, you've got holes in your skull through which the cranial nerves go through. Okay. So now remember, this whole thing is based on the notion that the body has wisdom, that the body knows what's going on, and that the body has structures in place to handle it. So you got a hole in your skull that the nerve is going through. And in a healthy person, the walls of the canal in the skull, the tunnel in the skull, are strong because the skull bone is strong. It's got enough minerals. It's got enough sulfur-bearing molecules. It's nutrified. It's strong. The tunnel is good. But because of lack of nutrition, lack of minerals in the food, it's easy as we get older for the body to become minerally deficient. And when the body becomes minerally deficient, the bones start to suffer. The joints start to suffer. In some people, it's the skull bone that suffers. And when that happens, the canal, the tunnel in the skull, starts to become weak. You know, it's like a cistern, right? And the walls start to crumble. Or, you know, like the famous tunnel in Boston, the Big Dig tunnel, where the roof collapsed, right? Right. That's not good. So the body knows when the tunnel is getting weak because the body has wisdom. So what does the body do? Well, the body knows that if that continues, you're going to go deaf, dumb, or blind, because those are the nerves that are going through those tunnels. The body doesn't want that to happen. So the body will put connective tissue inside the tunnel as like structural things to shore the tunnel up to keep it from collapsing, right? Kind of like the miner 49er, right, puts the wood braces inside the tunnel as they're tunneling into the mountain. So, but remember, the connective tissue shouldn't be there. It should just be a empty tunnel. But now there's connective tissue there, and what else is there? Well, the nerve. So if it's the nerve that goes to the eardrum, and there's connective tissue there, it's going to rub up against the nerve, stimulate the nerve, and that's going to cause ringing in the ears. If it's the nerve that goes to your muscles in your eye, you're going to get a lazy eye. If it's the nerve that goes to your tongue, you're going to get funny sense of taste or no taste. If it's the nerve that goes to the muscles in your face, you're going to get Bell's palsy. You're going to get face droop. Or trigeminal neuralgia, which is painful. It's also called tic douloureux. It's a really painful condition in the sensory nerves of your face, not because you have a bad gene, not because you're getting older, but because the nerve is rubbing up against connective tissue in the tunnel, and that's not bueno. So what do? We treat it like arthritis. So we eliminate the 12 bad foods. We give the body the foundation pack, and then extra bone and joint nutrients, which in this case would be extra plant minerals, extra calcium, and glucogel, in order to make the canals healthy. Because guess what happens when the tunnels in the skull get healthy? The body removes the connective tissue. Bada bing, bada boom. That beats poke in the eye with a sharp stick.
So now we have an individual who has long-term insulin-dependent diabetes. What's the best regimen for long-term insulin-dependent diabetics to lower their insulin needs for healthy blood sugar?
You got to pay attention to this, because this is important. If you're taking insulin, it's not good, and you need to know what your blood sugar levels are so you can adjust your insulin doses appropriately. Because not enough insulin is bad, too much insulin is bad. You got to hit the Goldilocks zone. And the problem with people who are doing this is that they get into automatic behavior because they don't think the blood sugar numbers are ever going to change. It's basically just based on what they eat, and you know, they're screwed and whatever. And so one of my most remarkable cases with blood sugar was with, how old was this kid when he came to see me? I think he was 12 or 13 years old. His parents brought him to see me. Insulin-dependent diabetic since he was 5 years old. In 14 days, just with medical nutrition, mostly nutritional supplementation. He was already pretty diet modified because of the blood sugar. He was able to reduce his insulin intake by 75% in 14 days.
Wow.
And that's huge because over time, you know, you've heard the stories about diabetics. They lose their toes, they lose their feet, they lose their legs, right? It's progressive gangrene coming up the extremities. That's not because of the diabetes, it's because of the insulin. Insulin over time causes that. So the less insulin that you need, the better it's going to be for you long term. And thank God for insulin, by the way. But we have to help the body optimize it. And it always works. So if you are going to do this program, you have to be mindful of your blood sugars, and you have to be disciplined in taking them and modifying the insulin dose, because you're going to be surprised, probably. So what do? We do the foundation pack. We do 1 or 2 extra bottles of plant minerals a month. We do 1 or 2 extra bottles of the Prohoba Omegas a month. And we do a product called Sweeties. And I would start with 1 bottle of Sweeties a month, which I think is 2 capsules twice a day. I would do that for 4 weeks and look to see how your blood sugar numbers are. If they don't budge that much, or if they just come down a little, then go to 2 bottles of Sweeties a month. And then go to 3 bottles of Sweeties a month. You got to find the zone that's right for you, because somebody who's 250 pounds is going to need more than somebody who's 150 pounds, right?
Right.
Somebody who's 80 years old is probably going to need more than somebody who's 35 years old, because your metabolic rates are different. So you got to play around with it, but it's not that difficult to do. So foundation pack, Sweeties, plant minerals, and Prohoba Omegas. And it's almost guaranteed. I mean, I've never seen that program not work to lower somebody's insulin levels. Might take 90 days for it to kick in. Might take 14 days. Who knows? But nonetheless, it's a really good program. And the less insulin that you can need on a daily basis, the better off your health is going to be over the long term.
The next one is a person who has an issue with hypothyroidism. Now, this week I was diagnosed with hypothyroidism, and because I don't like taking medications, is there something that I can utilize, such as natural supplements and vitamins, to positively affect my thyroid condition?
Thyroid's tough, but there's some interesting things to know about thyroid health. Number one, there are 4 really good lab tests that you can use to figure out how well your thyroid is doing. Most medical doctors only do 1. It's called TSH. And there are different types of TSH testing, by the way, depending on which lab does it, and depending on what your Medicare or Medicaid will pay for. That's what they order. And that's better than nothing, but it's not the best thing in the world. So you should have all 4 tests done, and we talk about that on the website. Now, if you do in fact have a thyroid problem, then you need selenium, because there are 2 primary thyroid hormones that your thyroid makes that help the body to function normally: T3 and T4. T3 is the more powerful of the 2. And in fact, the body turns T4 into T3. But in order to turn T4 into T3, you need selenium. Now, most people who have an underactive thyroid, they go to their medical doctor, they do 1 test, not all 4. And then if it is a problem, they're given T4, which is levothyroxine, right?
Right.
You would think they'd be given T4 and T3, because T3 is more powerful than T4. And I don't know why this is. I mean, there has to be some pharmaceutical funny business going on. I'm not really sure why, when this whole thing started, they pushed levothyroxine, which is T4, instead of doing both. Or, just T3, because T3 is more effective than T4 all by itself. I don't know why they did that. Don't know why that happened. But I smell a rat somewhere. But nonetheless, if you're taking levothyroxine right now, which like 90% of hypothyroid patients are, you want to start taking selenium. But when you do that, you want to read up on what it feels like to have an overdose of levothyroxine. Because the selenium is going to make the drug work more efficiently.
That's right.
And, you know, you'll start feeling funny and you'll think you have a brain tumor or something. And so, it's because the drug's working more effectively in your body now because of the selenium. It's crazy, but that's how it is. So we always give selenium to people who have an underactive thyroid. And just for insurance, I want people to go to a chiropractor and have a lateral x-ray of the neck while they're standing.
Okay.
Not while you're lying, but while you're standing. Because in a healthy body, there's an S curve that starts in the neck and goes all the way down the back into the butt. So in a healthy person, there's a little curve in your neck, which is the way that nature intended it to be. Now, there are nerves that exit the neck, and where do some of them go? To the thyroid. So if the curve in your neck is not correct, it's possible and highly probable that the nerves going to the thyroid will be squished or pinched, and the nerve transmissions to the thyroid will be subpar. Now, there's a condition called military neck, where you take an x-ray of somebody's neck, and instead of having a curve, it's straight up and down like a popsicle. That's a problem. I've had some patients where the curve goes the opposite way that it should. Instead of going forward, it goes backwards, right? It's like it's nuts. But that needs to be assessed. And if it's a problem, a good chiropractor, and by the way, good chiropractors are worth their weight in gold, as far as I'm concerned, will give you exercises and a treatment program which over time should restore the natural curve in the neck. And that's a really important thing to do for anybody with an underactive thyroid. Now, so we've got that covered. We've got the selenium. What else do we do? The foundation pack. And the only other thing that I've seen be effective for an underactive thyroid is switching your medications. So there's a type of medication called Armour Thyroid.
Yes.
Which is T3 and T4.
Right.
But guess what the pharmaceutical industry did? They discontinued it.
No, of course.
So now there's a product called Nature Throid, which you used to be able to get over the counter, but now it's a prescriptive item. And you mark my words, in the next 5 years, they're going to make that illegal also. But if you're currently taking levothyroxine, tell your doctor you want to try Nature Throid for 90 days and see if you feel better. Virtually every patient that I've switched from the straight drug to Nature Throid, or in the past Armour Thyroid, felt better when they were doing the new one. And use selenium while you're doing that as well, because it helps the whole thing.
Our last question is about vision. Would it be beneficial to use both Immortalium and Occutive together in place of Pressor Vision Arids 2? Also, if I take both Immortalium and Occutive, should I still take the 90 essential vitamins, or do all of these supplements combined contain too much vitamin A?
Wow, that's a very, very well thought out question. And here's the honest answer. Nobody knows. I mean, you can't tell, because how much of a supplement, or a drug for that matter, my body's going to absorb and utilize is different from how much your body's going to absorb and utilize. Everybody's different. So the only thing that you can do with medical nutrition, quite frankly with drugs too, which very few doctors do anymore, is you start somewhere and then you go up or you go down as an in-house experiment over the course of 4 to 6 months. And you look to see where the Goldilocks zone is. And that's the only thing that we can do in this regard. I will tell you that The thing that you need to be concerned about with these supplements isn't too much vitamin K, but it's too much selenium. Because even though selenium is an extremely important nutrient and it's one of my favorite standalone mineral supplements, it is one of the few mineral supplements you can actually take too much of. It's hard to do that with calcium. It's hard to do that with magnesium. It's hard to do that with most of the other supplements. But selenium, you can do too much. And if you do too much selenium, your hair gets dry and brittle, your fingernails get funky, they'll get loose, or they'll start peeling real easy, or your breath starts to smell fishy or garlicky. Now, you won't recognize that, but your wife or your husband or your brother or your sister or your girlfriend or your boyfriend will. So if you're taking a selenium supplement as part of your medical nutrition program, or a supplement that's got a bunch of selenium in it, and then another supplement that's got a bunch of selenium in it, and then another supplement that's got a bunch of selenium in it, you need to pay attention to that. And if those symptoms start to show up, we cut the dosage of selenium in half and see if it goes away. If it doesn't go away, you cut it in half again, and so forth and so on. But I don't know. I will tell you that years ago, Dr. Wallach was giving a lecture. This was like 15 years ago in Kansas City, I think. And there were like 5,000 people in the room back in those days. And he was talking about his experience with vision recovery, right? Nearsightedness, glaucoma, macular degeneration. And there was a medical doctor in the back of the room who was an ophthalmologist. And he stood up and said, "Wallach, you're full of crap." He said, "You can't recover from those illnesses. It's what I do for a living. It doesn't happen." They made a bet. He and Wallach in front of 500 people. Wallach said, "I want you to give me 10 of your patients with the worst vision, put them on my program for 90 days, and we'll see what happens." Every single one of the patients improved. So much so that the medical doctor who challenged Wallach repented and recorded an educational video called "Seeing is Believing" about his experience with vision recovery through medical nutrition.
And what was the program Dr. Wallach put those people on? Do you remember?
It was the 90 essential nutrients.
Okay, the foundation pack.
Extra minerals and extra selenium. Because back in those days, they didn't have Occutive. They didn't have Immortalium. That's all he did. Plus, of course, eliminate the 12 bad foods. And, you know, again, I need to underline something here. This is really smart, sophisticated, science-based, clinically verified, next generation, cutting edge medical nutrition. Developed and delivered by licensed physicians, right? But it's not a cure-all. It's not guaranteed. It's not going to work 100% of the time. There's all these variables. I mean, you know, how soon into the disease process are we intervening? What else is going on? How compliant is the person? And all of these things. So I don't want this information to come off as, you know, you do this and 100% of the time your blood pressure is going to normalize. 100% of the time your thyroid function is going to bounce back. 100% of the time your kidney is going to it's not like that. But what it is a really smart idea. And you don't know what you're missing. Your body knows what it's missing. You should run this one up the flagpole. You should kick these tires and slam these doors. Because as God is my witness, you might not know what you're missing, and your results might be remarkable.
Peter, I'd like to thank you for your time today, and I'd like to thank you for everything you have done, are doing, and will do. Okay, websites. Dr. Glidden, Glidden, drglidden.com. And also we have OperationFreedomHealth.com, where the products we have that we've discussed today, also the 12 Bad Food video, the other videos Peter and I've done. Peter, on your website, drglidden.com, educate our listeners on the contents of that site.
Lots of information about kind of along the same lines of what you just heard. I talk about, I think, 90 different health conditions. I talk about health topics, tell you how to detox correctly. And we're having right now we're having a 4th of July 4-day sale. So go to the website and check it out. because I've got all kinds of things associated with this sale. I'm giving away a copy of my book for free. I'm giving away an immune support video for free. I'm giving 3 months of a subscription to my website for free. So if you've ever really wanted to kick the Dr. Glidden tires and slam those doors and check it out, now's the time to do it. So go to drglidden.com and check it out.
Peter, I'd
You
like
won't
to
be disappointed.
and thank you, Peter, for everything you have done, are doing, and will do. The names of the books, folks. Everybody is Sick and I Know Why, and Attempt to Cure with Holistic Medicine. They should be the foundation of your medical library as they are with us. I thank you for your time. I thank you, Peter. Until next time, Dave Janda signing off. Dream big and dare to fail. Thanks for your time today.